your time. Have you seen a statement that has been issued by Lightwave?
I've seen something. I don't know whether it's coming from Lightwave because it's not a signed statement.
Okay.
It's not attributed to anybody, so I'm not sure it's coming from them.
Uh,
If you read the statement, it looks as though what the Honorable Okoboy said is the same thing they have rehashed on that paper.
I just spoke to a certain Erika J, with Senior Project Manager, Lightwave eHealthcare Solutions. Have you met him before?
Yes, at one of the meetings, I think I met him. So I know he's a project manager for Lightwave.
It says you've only met Lightwave once since the minister took over. Is that accurate?
You only met the minister once?
Yes, there's only been one meeting between, and that's September 3rd, between the minister and Lightwave on the contract.
Meeting us in person?
Yes, in person.
No, they are not, he's not the only one. He is a project manager. The company, owners of the company, who have been meeting with the minister. We've had several communication with them. So if he as a person, fine, but I have met him. The third meeting he's talking about was in a meeting, so I met him that day.
He also denied that they have any access at all to the system, that they said the system is local. So every facility has control of its own system, that they do not have any control, that you have a server on the first floor of your ministry.
That's not true. You can have a server sitting there. If you don't have access to the server and it's controlled by somebody outside, it's the same issue. You know, the way the IT system works, you would have a system that is managed from a server somewhere, and you have off-site server also. And then the off-site server may serve some purpose. But I can tell you that you cannot do anything with the system we have. You cannot go in it. You cannot do anything. They have total control of the system.
They are in total control.
Yes.
Of the system.
That's correct.
I see. Because it says they have no access at all. That the only access they have is one that is granted by the people at the facilities. That if they don't grant them access, they have no control of them, of that system.
It's the other way around. It's the other way around.
So it is the access that they grant.
Yes. Then I have visited facilities in 5 regions. I went to Volta region. I went to Western, North, Western, Central, Greater Accra when they were doing the assessment. I've spoken with account officers, managers, IT persons in these regions. And they will tell you that our problem is when we have issues, we have to wait for days for Lightwave to travel from wherever to come and take care of our system. And that is one of the things, if we can address for them, they will be happy. They don't have control.
I see. The two of you seem to be saying two different things. On the matter of whether or not they've been paid more for the work they've done or less, he is of the opinion that they've actually been paid less, because he says what is left, in fact, are mostly health centers. And per the contract, health centers, even though they are the highest number, they account for only 17% of the total contract sum. He said after they've done the 4 teaching hospitals alone, that is 21% of the work done. So automatically they're entitled to $21 billion, according to the contract they have. Is that accurate?
It's not. So now, the contract was supposed to be a 3-year contract. At the end of 2024, what it meant is that the contract was extended twice for 5 good years. Who is losing money? Is it the country or the contractor? Obviously, the country. If I've given you a contract to span between 3 years, and it's taking me 3 years, and it's taking me 5 years, even at the end of the 5 years, you have still not completed the project. Who is losing? It's the government. So I don't know the calculation they are doing. But if you have come to us and you say you want to work for me, you pay me this amount, I'll do the work for you within this period. And I have paid 77% of the total cost, and you have still not completed. I should be worried. I should be asking you to pay me some money for wasting my time. But because, we have slept on our right over the period, some of those things were not demanded. We have slept on our rights regarding the data. So now they can say that the data is with us, we have access. I work in the Ministry of Health. If we have access, it means there is an IT personnel who should have access. As we speak, we have spoken with IT people, and they said no. The system is controlled by the company, Lightwave. And they did not even have proper access because the company actually was directly working with the Minister for Health at the time. The Minister for Health was Honorable Kukwajima Menu. They have little control of the system because of that. So even today, we'll meet again. We'll meet the internal officers to speak to them about some of those things. Because severally they have informed the minister that they don't have any access to the system.
He was even saying that as he was speaking to me this morning, just a few minutes ago, he knows for a fact that some facilities were working.
So we have said that the system is turn on and turn off at will. We are saying that is what we want to work against. And that they were doing that because they wanted us to extend the contract. They were doing that because they think that we didn't have any contract with them and they were still servicing the system. So we need to pay them. If we don't pay them, they will shut the system down. And you remember they issued a press statement twice that they were going to shut the system off. And this is what we've been going through. National Health Insurance Authority has faced a blunt in this because, it's difficult for people to actually process their claims. It's difficult for the verification to be done before care is given at the hospital. So we have gone through a lot of problems regarding this. We expected that at least the system would have been on whilst we have that conversation with them and come to a final conclusion. But unfortunately, that did not happen. We were thinking that they could have signed a maintenance agreement with the ministry. They maintained the facility whilst we find a way of resolving the issue. But they said no, they will not give us the data. Based on that, we said, okay, that means that we have to look for a national health information system that will help Ghanaians. And we've been able to do that. As I speak to you currently, there are processes and procedure going on to put on board all the 450 facilities that were on the Lightwave project.
I see. And that's work ongoing?
The work is ongoing. But we can't wait because you and I will go to hospital and data will have to be taken. From few days or weeks ago, it was doing it on paper. So when you go, the OPD people write on some small paper. You go to consulting room, they write on small paper. It's a go to diagnostics. You go maybe lab or it's written on just papers. And then you leave the facility. Which means that these periods, the information we're supposed to gather to take care of our people, we did not have this information. And it was becoming a bit difficult. And as quickly as possible, we have to resolve it by getting this new system.
Well, he said they are still providing support to the hospitals, even though we don't have a contract with them. Do you know about this?
Yes, the system we are introducing now is not their system. However, the hospitals were connected and we have paid for. So what we wanted to do is what they are currently doing. Sign a service maintenance agreement with them. They maintain the system. But before we sign this contract, they must give us our data. They said no. So we have not signed that agreement. We don't have any agreement with them. Their contract has expired in 2024, and there is nothing we can do except to sign a contract. And if I have a contract with you and it has come to an end, I should be satisfied. I should be okay that I have had a good relation with you. So let's continue. But if our relation didn't end well, I'm not sure we'll be able to continue that engagement. So as it stands, whatever they are doing it at their own will, and it's not contracted by the ministry.
Well, Tony, thank you very much for speaking to us.
I'm grateful, sir.
Tony Goodman is the Deputy Director and Spokesperson for the Ministry of Health, joining us on the line, taking us 45 minutes past 9. Well, SM will deal with the matter of Fosua Herbal.
Okay.
Fosua Herbal. We'll take a break. We will come back.